but the underscore there is with respect. The underscore there is with respect. Otherwise, we are now ready to begin. It's 7 o'clock. Otherwise, we are now ready to begin. It's 7 o'clock. So shortly, we'll have His Excellency Waziri and those leaving His Excellency in the holding room alone, leaving His Excellency in the holding room alone at around 10 minutes. He gets ready to walk. Otherwise, tuko tayari 10 minutes. Asanteni sana. And otherwise, tuko tayari. Asanteni sana. And we're looking forward to a good production.
Director in the studio, please. Director in the studio, please put Lamu. Please put Lamu. Studio, whoever is controlling the studio, please put Lamu on screen for us within the auditorium. Lamu, please put Lamu.
the PS Ministry of Health, State Department of Medical Services, and the PS Public Health. Good evening, Kenya, and welcome to this presidential town hall conversation on health. My name is Dr. Mercy Korir. Our constitution makes a solemn promise that every Kenyan has the right to the highest attainable standard of health, and that no person should be denied emergency. For far too long, the experience of many families tell or fall short of that promise. In 2022, President William Ruto promised to change that reality, to build a health system. Good evening, Kenya, and welcome to this presidential town hall conversation on health. My name is Dr. Mercy Korir. Our constitution makes a solemn promise. Are Kenyans better off every Kenyan has the right to the highest attainable standard of lives of real people, and that no person should be denied emergency medical a crippling bill. The cancer patient receiving the experience of many families closer to their home fall short of that promise. Dialysis is now covered, and the family President is visited by a community health promoter before a manageable condition became care is a right for every Kenyan. That is why we are here for those who can not merely to recite 4 years later enumerate what has been done, simple, but to examine what has better off today, not only to celebrate progress, but the answer must be found in the lives of real people, and not simply the mother who delivered safely without facing, but to hear directly from them, the cancer patient who is receiving specialized treatment closer to their home. Patients, families, community health promoters now covered, doctors, nurses, the family, hospital administrators, by a community health officials before other manageable condition became a medical reform against lived experience. That is why we are here because this evening. The true measure of health reform or is not enumerate what has been done. It's not the money allocated what has changed, the policy not only announced to celebrate progress. It is but that patient who has been treated, the gaps that the life saved, and not the simply avoided about the family that has been protected. Hear directly from ladies and gentlemen, from you, welcome to an open conversation about the progress Kenya has made, families, that community health and promoters, it will take doctors to make quality health care reliable and accessible for every Kenyan, and other public officials will help us test the reform against the experience. Because the true measure of health reform is not the institution created. It's not the money allocated or the policy announced. It is that patient who has been treated, the life saved, the cost avoided, and the family has been protected. Ladies and gentlemen, welcome to an open conversation about the progress Kenya has made, the work that remains, and what it will take to make quality health care reliable and accessible for every Kenyan. Let's begin.
I commit to ensure, do hereby commit adequate numbers to establish community hustler health care program and establish December 2022 framework between every national Kenyan and county, including every government woman, in the payment shall be of their stipend. Ensure or shall have health insurance. I commit at affordable premium to provide mothers where they cannot afford babies, the government with diapers pay for their children, the women for pay a minimum of 3 months paid for by the government of Kenya.
And that, you know, it's also against the law to detain people for not paying bills. So there are a lot of facilities, especially those who are located along major highways, incur enormous cost in terms of being able to provide healthcare services to citizens. And I think that's the role of the emergency response.
We want to see issues of healthcare workers improve in this country, 100%. We want to see issues of HPTs and technologies, you know, healthcare products and technologies improve. We want to see issues of digitization.
We must figure out.
We want to go to the optimal level.
How we are going to start at the bottom. How the health center, how the dispensary, how the community health worker is going to be empowered sufficiently to be able to deal with the challenge right at the root.
A conversation
if
about
the dispensary
politics.
is working,
We're having a conversation about
if the 5 will work.
I want to talk about, which I know you can make an immediate impact, is healthcare financing. I think we should have a mixed model of health financing. Let me explain a bit. In financing, again, support both public risk pooling and private risk pooling. And you've mentioned it many times. And if you can contribute to NHIF according to your salary scale, rather than just a fixed 1,700 shillings, and it is pegged on salary, we could be considering it as a levy.
When we had the issue of emergency response, and this is a challenge that has been going back and forth. You have got people who get accidents and they rush to health facilities. Who is supposed to meet those bills? There was a proposal in 2017, and in fact it was legislated that there was an emergency response fund which was supposed to be set up. It has never been operationalized. And that needs to be done so that you can also encourage, for example, private health facilities are run by private investors. You cannot have them incurring huge costs which are never compensated consistently to be able to take care of. And that, you know, it's also against the law to be able to detain people for not paying bills. So there are a lot of facilities, especially those who are located along major highways, incur so that you have enormous cost in terms of being able to provide healthcare services to citizens. And I think that's the role of the Emergency Response Fund.
We want to see issues of healthcare workers improve in this country 100%. We want to see issues of HPTs and technologies, you know, healthcare products and technologies improve. We want to see issues of digitization optimal. We want to go to the optimal level, and health financing at the same time. Yes, we have moved leaps, but we want to go even further.
Kuna uchache wa CHPs. Mali kuna uchache, atuongeze tuko wengi.
We could make use of the community health providers to go down to the ground, to the Mwananchi, to the Mama Mboga, to the Boda rider, and just tell them whatever is available in the facilities, in terms of equipment and in terms of service provision.
I look forward to the President continuing providing that leadership that is required in ensuring universal health care is taken. And it's not just about the President, it's more important even we as citizens. If everyone takes the responsibility seriously, then nothing can stop us from achieving what we need to achieve.
About rubber meeting the road, that Wanjiku can access the care they need. Let me not even say care, the health they require. Health comes from both preventive, going to promotive, to now curative, as we're in curative.
Expectations for the improvement of services as we reach out to our households. We expect to be equipped with better kits and new kits, and the refills that are lacking.
We in the health sector have to up our game. You know, one is to ensure that we achieve universal health care in our country. Two, that we provide impeccable and similar services to our Kenyan people. Three, that our Kenyan people access all these services, you know, cheaply or in an affordable manner. That we make Kenyans healthy. Similarly, we also want to see how best we can actually create more efficiencies by automation, digitization, and embracing technology in healthcare space, because that's where the world is going.
We have called Kenyans here because health is a collective responsibility. It is not a one-man show.
Those were some of the expectations from allow us to welcome His Excellency the President to come and join us. When he's almost here, I'll just let you know so that we are able to welcome him. But as we wait for him to come, the reforms that this administration did were 4 major reforms. The first one was on the public health care. where we've seen community health promoters, and some of them are in this room. They'll be able to speak about their experiences and some of the people who have benefited from having community health promoters at their doorsteps. The one that all of us have been talking about the most is the Social Health Insurance Act that birthed SHA, the Social Health Authority, and marked the end of NHIF, the National Health Insurance Fund. The third one was on digitization, the Digital Health Act, which you should be able to unpack. And most of us have read, seen, heard a lot of stories about DHA. We'll be able to unpack all of those questions during this town hall. Then the fourth one was on the Facilities Improvement Fund, about facilities getting their own funding, investing in their own facilities, having that autonomy to decide what to invest in as a healthcare facility. We'll be able to hear from governors about their experiences, about, implementing some of these acts, implementing some of these reforms. But most importantly, like I'd said, as I began this town hall, is that we want to hear from you, the citizen. These reforms are about our healthcare, about your healthcare. It's about that mother who's in a village. It's about that man who's seeing us and that woman who's seeing this town hall. And they have very many questions that they've been wanting to ask or they've been seeking answers. So the people who are here in make it to this town hall, you will have an opportunity to ask any questions on their behalf. You'll be able to get clarity on some of the issues that we think need to be addressed in the healthcare in Kenya. So, ladies and gentlemen, President of the Republic of Kenya, let's be upstanding and we welcome the President. Let's appreciate the President as he walks in. Let's give him a warm, hearty round of applause as he comes into the room for this inaugural presidential town hall on health. Let's be upstanding as we welcome His Excellency President William Ruto, who will be able to take us through this town hall. Karibu sana, Your Excellency. Karibu sana, Your Excellency. Ladies and gentlemen, you can take your seats. Your Excellency, as we plan to start this discussion, I'm a media practitioner as much as I'm a medical doctor. I want us to see and address a certain elephant in the room.
Millions of Kenyans. How
and
much
these are some of the headlines.
And whether you even receive healthcare has been decided by an opaque artificial intelligence system. You don't get to see it. You don't get to question it. You just get a number. But for many on the ground, an entirely different reality is unfolding.
In the community, perspective and expectations. Walidhani ni kitu itawasaidia kulingana na venye ilitangazwa na serikali. It is so tricky. Unapata mtu aweza afford a meal a day. Unapata anaambiwa he or she is supposed to pay 650 and above. Pesa hata yeye aweza afford. Kwa hivyo, tangusha ikuje, kumekuwa na crisis.
Our audit found that it overcharges the poorest Kenyans while undercharging the wealthiest. We also obtained a document showing that the government knew of these risks but launched the system regardless. Knew of these risks but launched the system regardless.
Mr. President, those are some of the things the media has covered. But I want to take you back to 2022, where you made certain promises. One of them was that any mother that delivers will get free diapers. I thought in 2023 I'll be one of the first beneficiaries. I didn't get diapers. What happened?
Thank you very much, Mercy. And good evening, everybody. Welcome. This is a very good event, and thank you very much, Mercy, for asking me that very important and pointed question. But let me put this in context. There are many people who say I was elected in 2022 merely because I said hustler and bottom up. Today, I think you have seen that I made commitments. I had a plan. And I made commitments to the people of Kenya. And it is on that basis that the people of Kenya gave me a mandate. And it is what is expected of every leader, that if you want the mandate to lead a country, you must give the people your plan, your vision, your commitment on what you're going to do. And this evening, I am going to answer, and I'm very happy I saw the commitments I made before the election in 2022. Number one, I think I made like 7 or 8 commitments on matters health alone. 7 or 8 commitments. Commitment number 1, I said that we are going to have a health system that is going to make sure that every citizen can have access to healthcare. I called it that time hustler, but we came and said it should be called Social Health Authority. Today, my commitment on making sure that we have a system that works, a system where Kenyans can access health in a predictable manner, today is a reality, and 32.3 million Kenyans are registered on that platform. Number 1. Number 2, I made a commitment that we are going to have community health promoters. I said then, in good numbers. I can now stand here before you and the people of Kenya that we have 107,800 community health promoters. Trained, properly, deployed, and their stipends paid. I committed then that I was going to work with counties to make sure that their stipend becomes a shared responsibility between the national government and the county governments. Today, half the stipend of community health promoters is paid for by the national government, half the stipend is paid for by county governments, and I want to thank the county governments for working with me on that platform. I did make a commitment that we are also going to make sure that those people who cannot afford to pay, you remember the commitment I said is that everybody is going to pay as per their ability. And those who cannot pay, will be paid for by government of Kenya. Today, each and every one of us is paying in accordance with their ability, a percentage of their income. And those who cannot afford to pay, the indigents, we are paying for 560,000 households, representing 2.2 million citizens who the government of Kenya is paying for. That goes to the bottom of what commitment I made, that those who cannot afford will be paid for by the government of Kenya. And secondly, we are also paying for all teenage mothers, because we understand that every teenage mother doesn't have the money, and there we have provided resources for the government of Kenya to pay. Number 4, in that clip, I made the commitment that we are going to work on this from the bottom. I said every health center, every dispensary, every level 4 hospital must work for level 5 and level 6 to work. What have we done? Today, every health center, every dispensary, and I am sure there are people in our midst here today who are managers of health centers, managers or heads of dispensaries, who are going to tell us the difference that has been made by the reforms that we have carried out to every facility at that level. Today, every health facility, every dispensary, number 1, has a management board. Number 2, every facility today, for every patient they see, at the end of the month, they are paid by SHA. Every facility, every dispensary. Because I made a commitment that we must make the dispensary work, we must make the health center work for facilities on the higher level, level 4, level 5, level 6 to work. Today, with confidence, the governors are here, the managers of those facilities, I'm sure they are represented here, they will tell us the difference we have made. Number 4, I made a commitment that we are going to make sure that every mother, the question Mercy has asked me, every mother who gives birth, when they leave hospital, we are going to make sure that they have diapers. Right? That is a commitment that I must fulfill. Because we have already set the mechanism in place. We have already changed the way our Linda Jamii program operates. You remember, the Linda Mama program operated differently from the Linda Jamii. The Linda Mama focused on the mother and on delivery. Today, the Linda Jamii program focuses on the mother, focuses on the child, and focuses on the household. The numbers have changed. Linda Mama was 2,500 paid or refunded for public facilities, 3,500 for private facilities, 6,500 for cesarean section, 10,000 for private hospitals. We have changed that metrics. Today, from 2,500, we now pay 10,000 for all